Thank you, Mr. Chairman. Good morning, Mr. Counihan.
Morning.
It's good to have somebody here that is concerned about exact and precise numbers, because we've had a lot of trouble getting accurate numbers when it comes to the Affordable Health Care Act. And you gave a pretty resounding, rosy testimony in terms of how the health care law is working, but it doesn't seem to coincide with a lot of the people that I hear from, so I was hoping you can help clear up some numbers. You'd indicated that the uninsured rate is at the lowest point in the history of, or recorded history of the country. Is that correct?
I said that the uninsured level has dropped significantly.
And I think you followed with saying that it was the lowest that has been recorded. And I was wondering how you came to that number.
Just to be precise, sir, what I said was the uninsured rate is now at or near the lowest level recorded across 5 decades of data. Okay.
So pretty good. Well, how did you get that data? Where did it come from? How many people are insured in this country? What do we have, 310, 330 million
About
people?
330 million people. To be frank with you, sir, I would need to get back to you with that.
Okay. Well, how many people were uninsured when this law first came into effect, when they were selling it to the American people?
Sir, I need to do the same.
Well, I mean, roughly. You don't have to be precise. If the President was throwing out numbers, 30 million, 40 million were uninsured.
You know, sir, I'm not trying to be difficult. I really want to make sure that
Did you prepare at all for this hearing?
Yes,
I listened to your answers to Mr. Meadows, and it just astounds me that you can't remember whether or not you gave information to CMS or to the White House. I mean, that's your testimony, that you just don't remember?
No, it's not. What I simply want to say is that you've asked me a question that has to do with data. I respect that question. I'd like to respond with a precise answer.
Okay. If people don't sign up for the health care law, they're going to pay a tax penalty here soon, right?
Only if they do not qualify for an exemption.
So it's kind of hard to get the number of uninsured till we see how many people have to pay a penalty, because, you know, we've heard that the President said 30 or 40 million people were uninsured in this country. Now you're saying 10 or 11 million have insurance, and we have 330 million people, but yet is it your testimony that about 90% of the people who have signed up are getting subsidies?
What I would say based on our enrollment is roughly 87% of people that enroll in the marketplace.
Okay, so roughly 9 out of 10 are getting subsidies. Yeah. And we have 330 million people. You can't tell me how many had insurance and how many don't have insurance, but you're saying we have the lowest insurance rate, so you're not really helping me with your exact and precise numbers. But what we're seeing is people paying about $2,000 to $4,000 more for premiums, paying much higher deductibles, and yet the President promised most people's premiums would drop $2,500. So, I mean, it's clear at this point we were sold a bill of goods. Do you agree with that?
With deep respect, I do not agree with that, and the reason I don't is because I've been doing this between states and now here in this job for almost 9 years, and I've seen the impact of people getting access to coverage that's more affordable for them.
Well, you and I are talking to a different group of people, but let's move on. Let's talk about some more exact and precise numbers. This month, HHS announced that you will terminate coverage for individuals who signed up in 2014 who have been unable to verify their citizen status. So that's about 200,000 individuals, right?
It appears that it's going to be, that number is going to be less than that.
Okay, we've got numbers that show up to 312,000 individuals should not be receiving coverage. So that's not correct?
As Congressman, I would appreciate the opportunity to come back with you with precise numbers on all these questions.
It sounds like you're going to have to come back, because you're certainly not ready today. How are we going to get that? Well, first of all, how do these people sign up? What data do they need? Do they need a driver's license, a Social Security card? How can they sign up for health care if they're getting it illegally?
So an individual attests on their application to specific amounts of parts of information. We check that information against electronic data sources to verify its validity. There can be situations where that data is going to match. There will be situations where that data does not match. When the data does not match the verified sources, the trusted sources, it's up to that individual to provide the evidence that supports that they are legally eligible for coverage.
So how do we get this money back? And let me ask a second question. With the President's executive order with 4 to 5 million new people gaining access to Social Security cards and driver's licenses, probably the very information that it takes to get this health care coverage, how are you going to prevent that, and how are you going to get that money back?
Well, Congressman, I think the point is that we take self-attestations We verify them against proper data sources to make sure that they're accurate. If they don't, or they're not verified, the applicant is required to provide proof that, in fact, that is true. If the proof is provided, they may maintain their coverage. If the proof is not, and the appropriate subsidies and such, and the proof is not provided.
Bottom line is this law wasn't ready, and it's never going to be ready. I yield back.